Welcome to In the Waiting Room with Dr. Yas and Sam. Today we're going to be talking about acne. Okay, so I know acne has plagued all of us from children, neonates, to adolescents, to adults. And basically, before we talk about acne, we really have to understand the anatomy of the skin. Okay, so the skin is made up of several layers, okay, from the dermis to the epidermis. But what's really important is throughout the skin and throughout your face, you have something called pilosebaceous units. So I like to say the skin is like a sponge and there are holes throughout your face, okay? And each hole is a pilosebaceous unit. So you have a hole that's connected to a hair follicle and a sebaceous gland, which is an oil gland. Now what happens in acne is the pore gets closed up, the sebaceous gland continues to secrete sebum, and you get a blockage of that hair follicle, which you can call a comedone, an open or a closed comedone. Now, under the pore, there's a buildup of debris, sebum, and bacteria. That, combined with an inflammatory response, is a pimple. Okay. Now, there's different types of people who are predisposed to acne. You have people with epidermal hyperproliferation, so with a higher turnover of your cell. Also, people who have too much oil or excess sebum, if your hormones are erratic, or just if you're someone who has very oily skin. If you have too much bacteria on your skin, the most common bacteria is a propionibacterium. And also if you have inflammatory skin, if you have rosacea, sensitive skin and rosacea, which is common in Eastern European descent, then you are predisposed to having acne as well. Okay, so when you look at acne, you can see there are different types of pimples, as we talked about before. There are open and closed comedones, which are just blocked pores. And then there are inflammatory papules, there are pustules, and there are nodules. Nodules are greater than 5 millimeters and are deeper than pimples, and those are the ones that extend down to the dermis, and that's when it can cause scarring. So you see people with craters in their face from acne, that's from nodulocystic acne, and that's when we really get concerned and we start to think about big gun medication, okay? Now, when you look at your acne in your face, the first thing I want you to do is look at the distribution of the acne, okay? So is it in the T-zone? Is it on your cheeks? Or is it on your chin? Because that all means different things, okay? Usually during adolescence and whatnot, we'll get some T-zone acne. You get a combination skin and you get some more oil secretion in your forehead and your nose. It's a common thing. Just treat it regularly as we would treat regular acne, nothing too special. When you have acne specifically on your cheeks, it means that you have more inflammatory skin, drier skin, more eczematous skin, more sensitive skin, okay? So acne on your cheeks, you have more sensitive skin and you're prone to inflammation. Because you're prone to inflammation, you're also prone to rosacea. So in order to control your acne, then we also have to be very careful about moisturizing your skin. So we really need to moisturize your skin. We have to avoid irritants and allergens in our creams. And we have to basically change, modify your environment, get rid of toxins, get a humidifier and all that kind of thing. When you have acne on your chin, this is a very hormonal area. So if you're a lady with polycystic ovarian syndrome or an adolescent with severe menorrhagia and hormonal imbalance, or if you're a male adolescent and you're just going through puberty, then oftentimes you'll see big, pimples around the chin. That's when we think about hormonal modification. If you're a woman, you'd consider oral contraceptive pills and that kind of thing then. Okay, in terms of management, just for general acne, the first thing we do is we add topical agents. So actually before that, the first thing we do is cleanse our skin, okay? So if you have dry skin, only wash your face once at nighttime, and in the morning just tone your skin. But washing your skin doesn't just consist of cleansing your skin, it consists of cleansing, toning, and moisturizing your skin, okay? Cleansing, I like to use milk cleansers, okay? The reason why is that they're non-irritating and they're moisturizing. If you have very, very oily skin, that's the only time I would say use a gel cleanser because it dries out your skin, okay? The second thing is you have to use a toner. Toners have different kinds of acids in them and they clean out your pores and they close your pores. They're absolutely essential to good skin. Some of them have lactic acid, glycolic acid, salicylic acid, some of them have sulfur as well. So that's really important in order to clean out your pores and to close your pores so they don't get reinfected. Moisturizing your skin is very important because if your skin is very dry and you don't moisturize, your sebum, your sebaceous glands will go into overdrive and you'll get sebum that block your pores. And that's when you get even more pimples. So if you have dry skin, make sure you moisturize your skin. Oil-free moisturizer twice a day. Okay, after you've moisturized your skin, you're still having acne. Now let's go to the therapy, okay? First thing, topical over-the-counter medication. Things like retin A, adapalene, benzoyl peroxide, salicylic acid creams, Clearasil. You'll all see it's about 0.5% salicylic acid. If those things are not working, then you can come to the doctor and we'll prescribe you a topical antibiotic like clindamycin. Sometimes we combine clindamycin with benzoyl peroxide, and that's clindoxy cream, okay? If that's not working, we'll go to a topical antibiotic like clindamycin or tetracycline, even minocycline sometimes. If that still doesn't work, we'll try sulfur-containing compounds. Sulfur is a natural antibiotic, so it's just as effective as minocycline or tetracycline. It still doesn't work, no topical medications work, that's when we go to the oral medications, and the first thing we would try is an antibiotic, like oral clindamycin, sometimes metronidazole for the rosacea type patients. Okay, still doesn't work, we'll think about a hormonal component, and we will add an oral contraceptive. Again, Diane and Yasmin have thrombotic properties, and they do not cover they do not cover you for contraception, so be very careful for those. I'm not advocating for those medications, but other oral contraceptive pills like orthotricycline low are very, very helpful. There are also other hormonal therapies like spironolactone, which is a testosterone inhibitor that can kind of help with the sebum production. Finally, there are things like Accutane, and that's used only for nodulocystic acne. There's a lot of side effects. It's a teratogen. It can cause birth defects in your kids. It has hepatotoxicity, liver toxicity, and it can make you photosensitive. So Accutane is really something we only use for nodulocystic. Now, in the era of cosmetics, there are a lot of things we can do as well. I would really advocate for microdermabrasions every 2 to 4 weeks, which will close your pores and help with that, and will help clean out your pores as well. Lasers are very effective. If you have rosacea, go for the redness reduction laser, which will help with the sensitivity of your skin. Other than that, chemical peels are great too. You have to adapt the chemical peel to your skin type, so you can ask your esthetician to help you. I hope this helped, and I look forward to seeing you again. Bye.